We'll talk about is your action potential in nodal tissue or in pacemaker tissue. So your nodes, meaning SA node and AV node, they have a different action potential. How does it look? It's known as a slow response action potential. So this is how it looks, very much different from what we studied about cardiac muscle action potential, like this. This is your nodal tissue action potential. It's also known as a slow response action potential, and we must discuss why and why it looks like this and the ionic basis of it. So there's an important concept we must talk about over here called pacemaker current. Pacemaker current or pacemaker potential. So what happens over here? If you look at this action potential, there is no RMP. There isn't a single part where this action potential is staying vertical. This dotted line is the threshold potential, which I'm drawing over here, right? The firing level. And this action potential, if you see, is not having a single moment where the line is horizontal. It does not rest. There is no RMP. There is a phase of depolarization, you could see, and there is a phase of repolarization, and then you have this stage when you repolarize the cell, it reaches a level of negativity somewhere around minus 50 millivolts or minus 60 millivolts in AV node, minus 50 millivolts in SA node. And when you look at this negativity, you reach this level of negativity, maximum level, then the cell starts to automatically depolarize a little bit slowly by itself. So what happens here is there's a special channel called the funny current. It's also known as a HCN channel. HCN channel. And this is a channel that opens up in the cell, and it allows for sodium to enter into that cell. Sodium enters into that cell. Sodium. So that's one of the important things. There's also a calcium channel, T-type calcium channel that gets involved. I'm just giving you the primer for this. So we'll go in more detail later. The point is, the funny thing is, the cell is having a channel which opens when you make the cell negative. In all the other places we studied action potential, you make the cell positive and that opens sodium channels. But here we have a channel which opens up and allows sodium to come in when you make the cell negative on the inside, when you make it repolarized. So this is also known as a funny current. I for current, F for funny. So funny current that takes place over here. So this is very important in the pacemaker cell. This is what allows the pacemaker to keep working. Of course, you have your these channels not just located in the heart, but in certain parts of the brain. So don't worry about it, like in your retina and in your eyes. And there is a clinical correlate I'm going to make with this later. Okay, so let's just get into it now. So your pacemaker tissue, I've already made the notes over here, are also they make something called slow response action potential or pacemaker action potential or nodal tissue. So how does it happen over here? We have phase 4, phase 0 and phase 3. So what is phase 4? Phase 4 is this part where that funny current is working. This part which I'm going to draw in red over here, this is your phase 4. Phase 4. Then you have phase 0. I'll draw this in black. 0. This is depolarization phase due to entry of calcium. And then you have phase 3. Phase 3, which is repolarization. Right, so this is in green. Okay, so this is how we are going over here. This is phase 3, which is repolarization. Phase 4 is red, phase 0 is black, phase 3 is green. Please pay attention. 4, 0, 3. Whereas 1 and 2, ignore it. It doesn't exist here. Okay, phase 4, phase 0, phase 3. Phase 4 is where we have the funny current. Phase 0 is where we have proper depolarization. though it's not as steep as in the cardiac muscle. You could see the slope is not that steep. And phase 3 after that. So what's happening over here? Phase 4, like I said, here you are going to make the initiate the depolarization until we reach a firing level which is at around minus 40 millivolts. So here we have something called pre-potential or pacemaker potential or diastolic depolarization, it's also known as. And this is where the cell depolarizes itself or makes itself more positive when you make the cell reach this one, minus 50 or minus 60 millivolts. Now, depending on which tissue we are talking about over here, SA node or AV node. So the SA node is a little less negative. It's not like minus 90 millivolts in the cardiac muscle. It's very close to its firing level, and this helps in something that allows the SA node to set the pace of the heart, and we'll talk about that later, and about concepts like overdrive suppression. Don't worry about it. The point is, the cell is relatively less negative compared to cardiac or neural tissue for some reason, and this is where you initiate the funny currents which allow sodium to enter into the cell. So there is this kind of a channel called the HCN channel, and this channel, it has these these amino acids which act as voltage sensors. They will sense the the level of depolarization or repolarization that is happening in the cell, meaning the membrane voltage. And this is going to cause an opening of the channel when the cell becomes negative up to a certain point. It will be minus 50 millivolts in SA node or minus 60 millivolts in AV node. Also, these channels are very sensitive to cyclic AMP levels, okay? Cyclic AMP levels, okay? And this is important in some pharmacological aspects which we'll talk about later. Okay, so what happens is they open up and sodium enters into the cell slowly and gradually. Okay, so there are these sensors over there, the amino acids in the S4 domain. We call it the S4 domain of these ion channels, which will open up and allow sodium to enter into the cell. Once and it's not just the sodium that comes in. There's another current called calcium current. And this current happens due to transient or T-type of calcium channels. They will also open up, allowing for some calcium to enter into the cell. So it's not just sodium, it is also calcium that is entering into the cell during phase 4 through T-type, transient calcium channels. Then after that you have your decrease in the outward current of potassium which takes place. So you will block the potassium efflux, so reduced potassium permeability. An increase in sodium influx and also calcium influx is contributing to phase 4. It is not such a steep line, okay? It's not such a steep depolarization. It happens gradually, but it does reach the firing level at minus 40 millivolts over here. So you can see minus 40 millivolts. Okay, this is your firing level, which I've drawn in red over here. Once you reach that firing level, you initiate phase 0, which is depolarization. But now look at this. This is happening due to the influx of calcium through L-type calcium channels, not T-type. L-type over here in phase 0. So depolarization is happening through the influx of calcium, not sodium, not those fast sodium channels we studied in cardiac muscle. Very, very important to understand. That means sodium channel blockers like type 1 antiarrhythmics do not mess with your SA node, AV node, with the nodal tissue. Okay, very important to understand. So it causes a depolarization. You reach up to plus 10 millivolts, not plus 35 millivolts, plus 10, not like in the cardiac muscle or in the neuron, plus 10 millivolts. Very important. I'll just write that a little neatly over here. Plus 10 millivolts, you can see over here. Okay, and then after that you open some potassium channels. So the calcium channels close, the L-type calcium channels close, and you get the opening of potassium channels, causing potassium efflux through inward rectifier and delayed rectifier potassium channels. And so because this is nodal tissue, it is not having those fast sodium channels, voltage gated sodium channels We have funny currents, but not the fast currents and the fast sodium currents which we studied before. So tetrodotoxin does not block the nodal tissue. It will block the cardiac muscle tissue, maybe, or the neural tissue over there, okay, but not your nodal tissue of the heart.